Positive signs, as you heard there, emerging from a meeting between the Federal Health Minister, Jean-Yves Duclos, and Intergovernmental Affairs Minister, Dominic LeBlanc, and Ontario's Premier, Doug Ford. They were discussing the deal that the Prime Minister tabled just a few days ago on healthcare funding. It sounds, by what we just heard there, like Ontario is pretty close to signing on the dotted line. Alberta's Premier, Danielle Smith, said the same thing, something very similar, just a few minutes ago as well. She said she's not leaving any money on the table. She would have liked to see more, but she is prepared to take what is being offered. Let's bring in the front bench to talk a little bit about how all of this unfolded and where it goes from here. With me this evening, former BC Premier Christy Clark, former Ontario Premier Kathleen Wynne, and former Nova Scotia Premier Darrell Dexter. Hi, everybody. It's good to see you this evening. I feel like we've been talking about the prospect of this for a month, so now we actually have the tangible details to unpack for everybody. Christy, I wanted to start with you. It does sound like most premiers are willing to sign on the dotted line sooner rather than later, but were you surprised at all at the way this ended up going down and the sum of money that ended up being on the table for them?
No and no. So I think in terms of the sum of money, it's not a huge addition. I mean, it's about 1% more per annum than it would have gone up anyway as a percent of the federal government spending. And that, they don't have a lot of money to spend at the moment. Canada's a heavily indebted country. We're predicting slow growth. So they probably were wise to kind of, for their own financial reasons, to keep that down. I do think, though, in terms of the whether or not the premiers, of course they're going to accept it. The healthcare system is in urgent situation. Children are being turned away at pediatric care. People are dying in the hallways of hospitals, and no one can get a doctor or nurse to look after them because of the shortage. It's a mess. It needs money immediately, an urgent infusion, but money is not going to solve the problem. They need to have the courage to have a real discussion about profound healthcare reform, because if you think about this, Vassy, Paul Martin signed a very similar deal. It was richer. In 2004, it was supposed to fix healthcare for a generation. All it led to was more money, and more of the same problems. You can't keep fixing the same problem with just money anymore. I think we've proven that.
Do you think, Kathleen, first of all, do you agree with that assessment? And second, I mean, I can think of many premiers I interviewed this week who said very similar things, right? Who don't want to, obviously will not leave the money on the table, as Danielle Smith said just a few minutes ago, but also kind of acknowledge the fact that like something else has to go on besides just injecting more money into the system as it exists. What are your thoughts on that?
Yeah, so I agree with a lot of what Christy has said. It is an urgent imperative for the premiers to get these deals, these bilateral deals. It's also urgent for the federal government, politically, not just in terms of system change, to get agreements with the provinces and to drive change. And I think that there was change that came about because of the deal with Paul Martin, but there's more change that needs to happen now. I think that's what the shared priorities are about. It's also what the accountability measures are about. And I think we'll be in a much better position if, in fact, those accountability measures and those metrics are actually implemented across the country. We'll have a much better picture of what actually is happening, because I don't think anybody can say exactly what's happening in every province across the country, and we certainly don't have comparators. So I think although the premiers, I know, are disappointed at the amount of money, I think that there is an opportunity that the federal government's driving in terms of those reforms. And by reforms, and I have to say this, I say it every week, I do not mean for-profit incursion into the system, and that's one of the things that I really worry about, was not clear enough in the agreement.
Yeah, there's just a line about the Canada Health Act in this proposal that the Prime Minister put forward. Yeah, I just want to pick up on something Kathleen mentioned, Darrell, and that is around. I know that there's, everyone has signed on to this idea of greater data sharing. But what I found interesting in the reaction from various premiers was, for example, in Quebec, François Legault was like, oh, there's no strings, there's no conditions, this is great. And then the federal government's message was kind of counter to that, right? Like, we're in the bilateral agreements, we're trying to make sure certain outcomes are achieved. Like, Did you find this overly prescriptive, or do you agree with Legault's assessment? Which is it?
Well, I think first of all, framing this as a negotiation is kind of not really the right way to look at it. I mean, after
Point
all,
taken,
the federal government has full control over its own budget, so it will decide ultimately what's going to be in those packages, and of course, the provinces are going to accept those, mainly because they are more money. And in terms of the side deals, well, of course, the federal government is going to want to achieve certain reforms. They're going to want to achieve certain accountability measures. I don't find that particularly bothersome. I don't think it's overly prescriptive. We should say here, though, I think that we've been collecting data on the Canadian health system for a very long time. The Canadian Institute for Health Information, of course, has been collecting it for more than, I think, almost 30 years now. We certainly relied on that data when we were making decisions in Nova Scotia. Is it all that it could be? No, of course it's not. And part of that is because we now ask the healthcare system to do so much more now than we ever did before. Every year, we push more and more services into the healthcare envelope. So, of course, that envelope continues to get larger. And, of course, along with that comes the need for us to be able to collect more data. There are certainly outdated systems across the country that need to be updated. I agree fully with that. I think we need to see greater investment in that. And I think we're also going to see much greater investment in digital health and more electronic records, and that in and of itself allows you to better collect data. So, as we all agree, I think we all chaired the council at one point in time in our careers, and we know that the council comes together to try and frame the things that it wants to achieve. I think they've done a good job of that. I think the response of the federal government has been predictable. I think they will maybe try to top up the funding just a little bit to make things a little more palatable. But I think it is what it is.
Vassy, Canada has one of the most
really
expensive
quickly,
healthcare systems in the world. One of the most expensive health, in fact, the most if you measure by GDP. We have some of the worst health outcomes in the world for all that money. We've been trying to solve the problem with money for all of these years. And it's, I think, a sad thing that in this time of crisis, hardly any politicians, except maybe Doug Ford, are really talking about profound healthcare reform, because money is not going to solve this problem anymore.
I'll only just quickly add, having interviewed a bunch of them this week, they did say the same thing. A lot of them said money won't solve the problem, including I think it was Andrew Furey, as well as Premier Higgs in New Brunswick. So I'll just quickly add that caveat, but I do take everyone's point. Yeah, no, I mean, that's the follow-up question, and it certainly was.